Ladies and gentlemen, ministers, ambassadors, very welcome here to the Geneva Press Club. I'm the executive director of the Geneva Press Club, Pierre Rucci. I'm pleased to have this important event here linked to the World Health Assembly. And I'm very pleased also that we can talk again about noma here, this disease, that we already had the opportunity exactly, I guess, 1 year ago to talk about with the Ministry of Health of Nigeria, who was here. Unfortunately, he won't be able to make it today, but he will have for sure an ambassador replacing him. And I think it's a very important topic. There are some progress have been done, but not enough yet. So welcome here to the Press Club. And I hope you have an interesting discussion here. And now I give the floor to Marianne Comparé. Marianne Comparé is the co-director of the International Society of Neglected Diseases, Tropical Diseases. I'm sorry. Marianne, the floor is yours. Thank you.
Thank you so much, Pierre, and hello. Bonjour et bienvenue à toutes et tous. A very warm welcome to all who have joined us this morning here in Geneva, or whether you're connecting online from around the world. Thank you for being here on the occasion of the WHO's 76th World Health Assembly for this side event looking at from noma to health for all, addressing the imperative of the most neglected communities. As Pierre kindly introduced me, I'm Marianne Comparé, and I'm co-founder and co-director at the International Society for Neglected Tropical Diseases. And alongside numerous partners, Médecins Sans Frontières, Elysium, the first noma survivor organization, the Geneva Health Forum, the Swiss Alliance Against Neglected Tropical Diseases, the University of York's Center for Applied Human Rights and York Law School, and with the support of DNDi and the World Dental Federation. So a really very varied and wide range of partners. We welcome you very warmly this morning. So thank you for being here. And it's very exciting actually to hold this event this year. It's the year where the WHO celebrates its 75th birthday, and that's 75 years of commitment to driving health for all, which essentially is a commitment to striving in practical terms towards universal health coverage. And this is what we will be focusing on today. Yet alongside this march towards health equity, diseases such as noma do still remain devastating, underreported and neglected. Noma continues to cause the death of up to 90% of those it affects every year, even though it is highly preventable and treatable. And I think we should really reflect on that today. Noma may be a polybacterial infection, but of course it really, it's equally the product of malnutrition, of insufficient sanitation, poor oral health, co-infections, and therefore tackling noma not only in its own right is an imperative, but also will provide a very cross-sector pathway to strengthening primary health care where it is most needed to achieve universal health coverage and also bring health for all within reach of the most neglected communities. And that is a message that's really being echoed again and again during this very important week. So despite these challenges, as many of you will know, perhaps you were here already last year at a noma side event, but the past 2-3 years have nonetheless been really exciting in terms of noma advocacy. Through renewed campaigning and awareness, noma is finally getting some of the attention that it really deserves. A landmark oral health resolution was passed 2 years ago at this very World Health Assembly, and firmly placed oral health and noma on the UHC and Global Goals agenda. And all importantly, this year, following the lead of the Federal Ministry of Health Nigeria, over 30 countries submitted a dossier of evidence to see noma included in the WHO's own list of neglected tropical diseases. And so with kind of all of this in mind, over the next 90 minutes or so, it will be my pleasure to invite you and the many partners here today, and all importantly, the noma survivors, to finally put a spotlight on noma, take stock of the journey so far, but also look towards next steps. In the first part of this event, we will hear why and how at some of the highest levels it's a priority to hone in on neglected diseases, neglected communities, or reaching equity in health. And then we will then have an opportunity and pleasure to hear from our panelists regarding their experiences and views on noma advocacy and how they see the next steps and also shaping the future towards health for all. But before we start, it's really important to remember that when we talk about neglected diseases, we're really talking about neglected communities. It's not uncommon, even for colleagues with substantial experience in public health, to have quite simply never heard of noma. I have the very strong feeling this is less and less the case, particularly this morning in this room, and of course to all our colleagues tuning in online. However, nonetheless, one often hears that one image says 1,000 words, and if that is so, then a short film can tell 1,000 stories. And that's why on this occasion, and by way of introduction, I see no better way than to open this session by sharing with you a short film on noma called Surviving Noma, created by Claire Gentet and Fabrice Canterini from Enedis, who are here in the room. Some of you may already have seen this, as it was selected at the WHO's very own Health for All Film Festival, and it is based on a longer film called Restoring Dignity, which I hope you'll also have the chance to see, which we at the International Society for Neglected Tropical Diseases, we were compelled to give an award at our very own annual awards. So without any further delay, let's put the spotlight on noma at WHA76. I once again thank you very much for joining us, and so let's set the scene with this very short film. Thank you.
Ina kwance lokacin ina kamar zazzabi, yana jin na ya kumbura duka. In sa hannu na yana jin din yayi laushi. Sai nake kuka. Ina kuka ina kwance ni ne ta zaure ko da sa hannu in ji ya tsure.
Noma is a gangrenous infection of the face, which usually starts from the gum or the gingiva to the fleshy parts of the face. It destructs the bones, the soft tissue, and everything around the face. It affects children at the age of 2 to 7 years old, but usually from 2 to 4. It can affect anywhere on the face, mainly on the sides. And there is also a central noma which affects the nose and the upper lip or the lower lip.
No kaga da rawanin da ko da ni tashi da rawanin gani da ni wayo rawanin ga kullu irin ina tare da wannan rawani ina rube fuska na. Da sai ni hita tan wani kaya ne zabo ko Allah ya bani wallahi.
Na shekara ko ina tare da su. Ka gani don mata na biyu yayi duk sun ka jahi. Yan kayo ni an ka ce ko ni aiki la tahiya ni kai don ba mu so ne. Kice to ni mutuwa dai ka sani in tahi in bari.
Noma patients really have that stigma whenever they get into the society. it's hard for them to, integrate into the society because of the disfigurement on the face. And they also have a lot of difficulties while eating, while feeding, because if half of the face is down, is gone, is eaten by noma, you'll find out that patients, have to do some maneuvers for them to get food into their mouth and then to swallow. And part of the problems they are facing is a speech problem.
When somebody is like that, definitely there will be intimidation between you and people. No one came to this hospital and go back remaining the same, because the way they come, they will go back different. Since the operation was done, I'm so happy. I can go to anywhere, I can stand with people at anywhere. I felt I'm a human being like others. To anybody that is in my condition like this, they should not feel bad and they should not lose hope.
Really beautiful film again. Thank you, Claire, Fabrice in the room. Also, I'd like to take this opportunity to salute Mulikat Onkanlawon. Mulikat, if you're hearing us online, Mulikat, who's featured in the film, was going to join us but couldn't make the travel. But you're with us in our hearts, and Mulikat is co-founder with Fidel Strub, who is here today with us, of Elysium, the world's first noma survivor organization. So a wonderful film to set the scene and really give an idea of the dimensions of the challenges, also the survivors' courage, and also the courage of the healthcare professionals who are trying to really operate sometimes in very difficult conditions. So lots of things that perhaps we can bring back into our discussions over the next hour or so. So without any further delay, I'd like to move on to the first part of this meeting, and we're going to hear from our colleagues and who will tell us a little bit more about why, at a high level, it is important to tackle neglected diseases, to reach health equity, and with particular reference to noma. And so without any further delay, if I could invite up to the stage our first set of speakers, His Excellency, Mr. Abiodun Richards Adejola. Mr. Adejola, you're a permanent representative of the Federal Republic of Nigeria to the United Nations, so if you would like to join us up on stage. We're also very honored to have Dr. Mai Al-Kaila. Dr. Mai, Minister of Health for Palestine, welcome, and thank you for joining us. Rachel Kenna, you are Chief Nursing Officer with the Department of Health, Republic of Ireland. And Dr. Tong Ryung Jung from the Division of Emergency Response. You are a Director with the Korea Disease Control and Prevention Agency. And then from the WHO's own Department of Control of NTDs, Dr. Kingsley Asedu, you're a team lead for skin NTDs, disability management and inclusion. So thank you very much for joining us. His it's a great honor to have you here with us, and without any further delay, I'll hand over the floor to yourself, Mr. Adejola. I think at the table you will be using these microphones. Are they? Yeah, of course.
Good morning, everyone, and thank you so very much for coming today. We would like to seize this opportunity on behalf of NOMA, Medicines Frontiers, to thank everyone, to extend appreciation, very deep one. Ordinarily, it's we're supposed to have my Minister of Health here today, but we're in the process of transition back home in Nigeria. We'll be changing government next week, so everyone is busy, all hands are on deck. But let me start, having thanked us, let me also start by saying some bits and pieces, NOMA. Indeed, we've heard that NOMA is finally getting the attention it deserves. And truth be told, I love the theme, from NOMA to health for all. NOMA, as we all know, and as has been highlighted very stridently from the short clip we saw, is a gangrenous disfiguring disease, of course, starting from the mouth. And I actually love the way it was captured. They say, seeing is believing. The exact cause of NOMA, well, the doctor did mention a couple of things, but many are still unknown. But risk factors include severe chronic malnutrition in children and lack of access to adequate health care and poor oral hygiene practices. And if left untreated, NOMA has a staggering mortality rate of up to 90% within the weeks of the onset of the disease. And survivors of NOMA have significant aesthetic and functional sequelae, disfigurement, impairments in breathing, swallowing, speaking, vision, and definitive mouth closure. And child and adult survivors are reported to experience intense social isolation, stigmatization, and discrimination in realizing their rights to education, to work, to privacy, and family life, among others. Previous endemic to North America and Europe, where it was last present on a larger scale. NOMA exists today mainly in Africa, in Asia, in Latin America, and in some parts of immunosuppression, such as HIV in the global north. And in 1998, we all know that the World Health Organization estimated that 140 new cases of NOMA occur globally each year, and 770,000 survivors were living with NOMA sequelae. More recent research indicates NOMA's occurrence in the past decade in at least 23 countries. We know of countries such as Afghanistan, Benin, Burkina Faso, Cameroon, Chad, China, Ethiopia, Ghana, Guinea-Bissau, India, Indonesia, Italy, Kenya, Madagascar, Mali, Nigeria, my country, Pakistan, Senegal, South Africa, South Korea, Togo, and Uganda. But I would like to seize this opportunity again to thank the 31 member states of the UN that supported Nigeria with letters of endorsement for the listing of NOMA in the disease, in the WHO list of neglected tropical diseases. I would also like to mention those countries and to thank them so profusely. Austria, Benin Republic, Botswana, Bulgaria, Burkina Faso, Cabo Verde, Canada, Chad, Costa Rica, Ecuador, Guinea-Bissau, Ireland, Japan, Kenya, Liberia, Luxembourg, Mauritius, Mexico, Mozambique, Namibia, the Netherlands, Niger, the State of Palestine, Republic of Korea, Russian Federation, Rwanda, Senegal, Slovakia, Spain, Sudan, and our host, Switzerland. There is also the need for us, and of course we'll be hearing more, to support and then keep, I was discussing with some colleagues over there that when you feel you bursting the tape, that is when you need to put in more effort. So we need to keep calling for support of research and efforts to contain noma disease, which is completely preventable and treatable. I thank you, and I will hand over to them. Thank you so much.
Thank you so much, Dr. Adejola, and you did beat me to it in terms of congratulating those countries that have really taken this very historic step to support and co-sign this landmark application to get noma out of neglect and include it on the WHO's NTD list. I'll hand over now to the Republic of Ireland, another co-signatory, Rachel Kenna, your Chief Nursing Officer, and thank you for joining us today.
Good morning, everybody. I'm delighted to be here on behalf of the Minister for Health for Ireland, and thank you for the invitation to be here with you all this morning. The short film was a wonderful way to set the scene. A Better World, Ireland's policy on international development, highlights our support for health systems strengthening. Ireland's commitment to global health and our work to end HIV, TB and malaria is rooted in our deep understanding of the relationship between poverty and poor health. Amidst this period of great turmoil and uncertainty in our world, our attention is pulled back towards crisis after crisis. Our sustained commitment to tackling pre-existing health challenges is more important than ever before. COVID-19 strengthened our understanding that health is everyone's business. In preparing for future threats, we must prioritise our investments and focus on the furthest behind, including those hard-to-reach settings. This can only be done effectively by investment in national health systems, including surveillance and response capacity. As we move into the post-COVID pandemic world, we must also address the fact that the pandemic has stalled years of progress towards the achievement of the Sustainable Development Goal 3, health and health well-being for all. We need to renew and redouble our efforts on all fronts, in particular in strengthening national health systems. We need to get routine immunisation back on track. We need to bring maternal and neonatal mortality rates right down, and we need to do more to end the epidemics of HIV, TB and malaria by 2030. With that last point in mind, in 2022, Ireland committed a 30% increase to support its global fund for the next 3 years. This was done in recognition that approximately 1/3 of grants are channeled into strengthening health systems and increasing surveillance. Noma is a non-communicable destructive disease which disproportionately affects young children living in poverty. Its morbidity and mortality are high, and survivors and their families face stigma and discrimination. Causative factors include malnutrition, poor oral hygiene associated with lack of access to toothbrushes and toothpaste. While noma is not present in Ireland, it was recorded in the population during the Great Famine, 1845 to 1849. It is a matter of grave concern that it continues to affect communities in some parts of Africa and Asia. As cases have recently been reported in Italy, it is also a matter of concern for the EU to protect its population from noma and conditions which it allows it to occur. As advocates for global health and active participants at the WHO, we in Ireland believe that a global response to noma is appropriate. This view is also reflected in the World Health Assembly Resolution on Oral Health from 2021. On behalf of the Minister for Health, I would like to offer Ireland's full support to the Government of Nigeria and its proposal for the inclusion of noma on the WHO's list of neglected tropical diseases. The Minister hopes that this will be an important step in the eradication of this disfiguring and deadly disease. In addition to the WHO's list of NTDs, this will shine a spotlight on the disease, facilitating the integration of noma prevention and treatment activities to existing public health programmes and allocation of necessary resources. I would also like to thank MSF for your ongoing work. MSF supports the world's only dedicated noma hospital in northwest Nigeria. MSF have also been at the forefront of their campaign to raise awareness of noma and accelerate the research and the advocacy agenda. Thank you very much.
Thank you so much, Ms. Kenna, for this really important reminder that regardless of the disease ecosystem or landscape in one's country, we're only all as strong as our weakest health system. So your words are very much appreciated, particularly the support to the noma cause. So thank you. Handing over now to Dr. Al-Kaila for a few words. Would you like to speak from the table here? Thank you. So. Dr. Al-Kaila, Minister of Health for Palestine. Thank you.
Thank you. Good morning, Your Excellencies, friends, colleagues. Good morning. I am honored to be here to endorse. We endorsed already in writing, but also to re-endorse this very important initiative. As you might know, Palestine is not a tropical country. However, as in Palestine, we believe in global health and health for all. We endorse this, especially for such communities which are, I don't like the word neglected, because nobody should be neglected, but it is used. I cannot find any other term. These what's called neglected communities. Actually, when we are talking about health for all, and we are here as ministers of health and health staff from all over the world, we are talking about global health, equity, and health for all. Therefore, my dear Minister or Your Excellency, our endorsement can come from this concept that global health, health for all, we are endorsing, and we are thankful for Nigeria and the government of Nigeria for taking and put on the surface such an important and neglected, really neglected problem. Therefore, my congratulations for you, and always we are working in Palestine for health for all. Thank you very much.
Thank you for your support, Dr. Al-Kaila. And now for a few words from Dr. Jung. Doctor, you are representing the Korean Disease Control and Prevention Agency, and Republic of Korea being another supporter of the noma inclusion.
Thank you very much for giving me the opportunity to speak at this important event. In Korea, we don't have noma, so we don't have enough information and experts regarding noma. But I think one thing is very clear. All treatable disease must be treated, and access to treatment must be guaranteed to all. So, in this sense, we support the international community's effort to include noma on the WHO list, and following the legacy of former Director General, WHO Director General Dr. Jong-Hook Lee, who had a great passion for fight against noma, and we will pay attention, continuously pay attention to this issue and collaborate with you. Thank you very much.
Thank you so much. And after what we can only describe as very unified voices from member states, I'll hand over to Dr. Seydou from the Department of Control of NTDs at WHO. Thank you for joining us.
Thank you very much for the invitation. Dr. Sose Fall, who is the director of the department, was supposed to be here, but given the busy schedule during this period, he has access to represent him. So I'm here with about 3 of my colleagues, just to show also our commitment to any disease that affect the poor and disabled people. Within NTDs, as you are aware, we have also the NTD Roadmap 2020 to 2030, which defines our path towards targets set for 2030. And of the diseases, 20 diseases within this group of NTDs, some of them cause severe disability, and therefore I can see some similarities when I watch the video of noma. The disability, the stigma, the need for reconstructive surgery to improve the function of people affected by NTDs as well as noma. And also just to highlight that, as has been mentioned, that Nigeria, together with a number of countries, have submitted a dossier to the NTD for consideration for inclusion into the list of neglected tropical diseases. This dossier has been shared with our strategic and technical advisory group, which is our advisory body, and they are reviewing it. Hopefully, we will get the outcome of it in September when the group meets. But irrespective of that, I just want to highlight that help for all, leave no one behind. It's imperative, and we should continue to fight for all diseases that affect people everywhere. There is no wall between one disease and the other. And the same health workers, the same communities are affected. So I think that whatever the outcome of the review process is, we have already started to work together. We have developed online course for NTDs, for which we have included noma. We have developed a skin app for a number of neglected skin diseases. We have also included noma. So we are already also talking with the noma community. So I think as health workers, as I said, there is no barrier, and we'll continue to engage each other. From my own experience, when I joined WHO many years ago, we work very closely because my area of interest is on borreliosa, which is also a disabling disease. So we had a very good contact with the team working on noma at that time, in early 2000, late 1990. And in 2006, they used to publish what we call the noma contact. This is a copy from 2006. And in this document, we were also produced a chapter on noma and borreliosa, looking at some of the similarities around stigma, disability, the need to train doctors to do plastic surgery, rehabilitation, etc. So it's not far, as far as I'm concerned. My previous experience and exposure with noma, I hope that we will continue to champion this disease, given the devastating that it causes. So I thank everyone who is gathered here and online, and also Nigeria for championing this effort, MSF and many other supporters of noma. Let's continue to address this disease. Thank you very much for your attention.
A huge thank you to our first speakers. It's really encouraging to hear from such a diverse member states, but all speaking with a unified voice about noma, and also from the WHO's own NTD department itself. But these aren't just kind of words, as Dr. Seydou very succinctly summarized. There's now noma part of the Skin NTD's app, the bulletin that already in 2006 was being circulated, and lots of very concrete kind of initiatives now, a network really growing with now the second WHA side event, lots of online events, and so although noma is really taking its spotlight now on the global health agenda, the next steps continue. We do at ICNTD run quite a few online events, and I'm often asked, well, how many people attend? And the answer tends to be, well, it depends how neglected your disease is. And so I'm very pleased to say that today we have over 500 people registered online. We almost have a full house right here in Geneva. So, you know, this is a great moment for noma advocacy. However, and this is will be the second part of our event, what lays ahead and what is the road ahead to really move this forward in the agenda, bringing it as well into the road to UHC and Health for All. So in a few moments, I'll ask our next speakers to come. But before that, I'd like to give another very big thank you to yourselves, the 5 speakers here, and also really another recognition to the 32 member states that have supported the dossier. So thank you so much, and another round of applause for your very poignant words. And now for the second part of the event, we'll be hearing a little bit more from our colleagues. Oh. Thank you so much. Yeah, thank you. Thank you. So I'd like to call, please, to the stage Fidel Strub, noma advocate and co-founder of Elysium Noma Survivors Organization, Dr. WHA76, co-director of the Center for Applied Human Rights at the University of York and the York Law School, and Dr. Ben Thomas Nyangwa, MSF medical director. I'll just give a hand with the name tag. And perhaps you were also expecting, based on the program, to hear some words from Dr. José Leonardo Ruales Estupiñán, Minister of Public Health, Ecuador. Unfortunately, Dr. Estupiñán is sending his apologies, but we do have a short statement, which I'll be very happy to read after our panel discussion. Right, so over roughly the next 30 minutes, we'll have an opportunity to hear from our colleagues perhaps a bit more of a personal or organizational view on why noma advocacy is important to them, and how they see this fitting into the march towards health for all. And so perhaps starting from yourself, Bernd, so you're here with MSF, and obviously one of the powerhouses of the noma campaign. And so as MSF medical director, perhaps you could give us a few words on why this disease has been so important in MSF's work.
Okay, thank you very much for inviting us, but also for being present, all of you in this forum, and of course online. A number of you in this room and also online, you'd understand or know of MSF, Médecins Sans Frontières, playing a key role in the campaign around noma. However, I also know that some of you here and even beyond online and so on, you would also know the role that Médecins Sans Frontières plays mostly in emergencies and in conflict and in disasters. So why and how does MSF end up in those potentially looking like extreme situations? And I think ultimately it's about the individuals. For MSF, it's about the response, the solidarity we give to individuals who are suffering, either from neglect or from emergencies. And when it comes to the conversation we're having now around noma, for MSF, we think it's really critical that noma is put on the WHO NTD list. Why is that? We feel that what we do, MSF has been involved and focused at this moment a lot in the hospital in Nigeria, where we focused on treating the effects, treating patients who have had survived noma. However, we also feel that this needs to be streamlined much more around the earlier interventions. As MSF, we'll continue integrating these interventions in our programs around the world, but also continue to really advocate for this work to continue. The focus on noma has to continue for us to really get to the Health for All target. Thanks.
Fidel, you're about to celebrate the first anniversary of Elysium, so congratulations on that. And could you tell us a little bit more about your journey and in terms of noma advocacy and how you feel this fits into the global health agenda at this point?
Thank you very much. My name is Fidel Stroop. Thank you, everyone, for coming here live and physical online. So I was diagnosed with noma in 1994 in Burkina Faso, and and I'm one of the lucky ones who survived noma. And through all the ordeal, through my teenage years, I realized that nearly no one knows about noma. There is no real aftercare. And through this led to this day. Here I stand, and I co-founded Elysium with Mulikat. And Elysium stands for Elysium Noma Survivors Association. And the idea is that we speak for the 90% of the victims who didn't make it. As we know, noma is quite deadly. And we want to focus on the things which policymakers, healthcare workers have to concentrate after the effect of noma. We don't really know how many survivors are there after 2, 5, 10, 15 years. For Mulikat, it took around 15 years to accept herself as she is with noma. For me, it took a bit longer, nearly 20 years to accept the way I look. And this is something which is also forgotten about this neglected disease. And we want to provide the insight from our view to you, because it's not easy to imagine for you who don't experience noma how to go through with it. And I think it is very important as a survivor to give insight to all the policymakers and organizations to better understand and also to convey the importance of noma, that we have to fight it. Noma is quite easy to fight, and we really need to invest in social security, in the healthcare and the accessibility to education and basic healthcare all around the world. What I really want also to tell you is noma, or what we need to do is to let go of the shackles that noma is only prevalent in Africa. Noma is vastly underreported, and it's not only in Africa. We have cases in South America, surely in Asia and other countries, sporadically also here in Europe. So it's not something which is only existent in Africa. So we really need to let go of this idea that only Africa is affected. It's a global health crisis. And in this fight, we all can do quite a lot of change. And I can assure you that in this fight, there will be absolutely no loser. There can only be winners, because everyone will benefit locally and globally.
Fidel, absolutely. Thank you for reminding us that investing in noma is just purely a win-win situation. It is preventable, it is treatable, and I think you really drove home with talking about 15 years for Molikat, 20 years for yourself, what we mean by the burden and the impact of a disease. So thank you. And it's been really interesting today to broaden kind of the lens from noma, the treatment, but also opening to UHC, kind of a broader, really a movement to this kind of right to health that is really prevalent at the moment. And this is, I think, a great moment to hand over to you, Joanna, because you open the lens even further and really provide a very strong case to the human rights approach to tackling noma. So over to you, Joanna.
Thank you very much, Marianne. Good morning, everyone. I am humbled to have been invited to speak on this panel alongside an inspiring a person such as Fidel, who is, and I just want to emphasize that again, the co-president of the first Noma Survivors Association and a distinguished humanitarian practitioner. I wish, if you allow me, to applaud the organizers of this event for centering the voices of survivors here today. I think this is essential, and I'll explain why in a second. I am a human rights scholar, so you may legitimately wonder why is she speaking today in a side event at the World Health Assembly. Human rights fora are around the corner in Geneva, not quite here, but I can assure you that neither I nor the organizers have gotten the venue's address wrong today. I think I'm here to remind us how important human rights approaches to neglected tropical diseases more broadly and to noma as such are. And I will make 2 points in my intervention today, as you asked me to base it on my own experience of working on noma since 2009. But before I make those points, I would like to foreground them in the following observation. Noma meets each of the 4 criteria of a neglected tropical disease. Noma predominantly affects people living in conditions of poverty and causes important morbidity and mortality in these populations, therefore justifying a global response. Second, it affects people living in tropical and subtropical areas, not only, but predominantly. Noma is immediately amenable to broad control. And noma has been neglected in the field of research. These are the 4 criteria for noma to be listed as a neglected tropical disease. Evidence for this has been put together in the dossier submitted by Nigeria with the 32 co-sponsors to the WHO STAG. So NOMA's inclusion on the formal WHO list of NTDs would be a recognition of fact. Okay, coming to my 2 points. They're drawn from research conducted with my brilliant colleague Alice Trotter at the University of York's Center for Applied Human Rights and the York Law School. First, human rights approaches to neglected tropical diseases place an emphasis on certain substantive and process features that help us to see the human beings affected by NTDs as human beings, not just through the narrow lens of their diseases. As to the substantive features, a human rights approach clarifies that at stake are legal, enforceable rights, not merely needs or charity. To be very clear, the work that has been done on NOMA so far has relied on the exceptional goodwill of really maybe 2 handful of charities, of organizations that have cared about this. And that is important, and they have a know-how that we need to draw upon. But beyond that, NOMA, individuals who are at risk under NOMA and those that are surviving NOMA are right holders, and states have legal obligations towards them. And it is really heartening to have heard the 4 interventions by representatives of states today who, in my view, have stepped up towards those obligations by supporting NOMA's inclusion in the WHO list on NTDs. Okay, as to the process features of the human rights approach, participation is a central one. Incorporation of human rights perspectives into NTD planning and programming will be vital in ensuring that people affected by these NTDs take up positions at the forefront of the agenda, and that their lived experiences inform these processes at every level. Accountability is the second important process feature, and this is accountability of duty bearers for the performance of their legal obligations. Now, this need not always mean litigation or subjecting states and other actors to naming and shaming for failing to realize their human rights obligations. Accountability can also mean ownership of the process of realization of human rights. And in my view, again, this is what we see with Nigeria, the efforts that it has done in country and other states, such as Burkina Faso, to name just 2, but I don't want to exclude others. The efforts that are undertaking in country, and by leading the campaign for the NTD listing, this means that these countries are assuming accountability. Those countries that are supporting this, those countries that are increasing the funding for NTDs, they're assuming this accountability. They own the issues. Okay, my second point. Human rights approaches to neglected diseases, including NOMA, serve as a fundamental reminder that this NTD frame, this lens, this label, is or should be more than a medicalized lens. The WHO NTD classification recognizes that diseases with significant morbidity and mortality are overlooked in the global health agenda precisely because they affect populations living in poverty. The over-medicalization of NTDs, and by that I understand the application of exclusively or predominantly medical knowledge to social problems, goes against the very aim of establishing in the first place the category of WHO NTDs. At the very origin of the NTD frame lies the recognition that structural discrimination within countries, and importantly within the global health system and the economic system, exists, and this needs to be addressed. So those of you in the room here, and I see many colleagues, who are advocates and practitioners working on NTDs might be worried of me pointing to the structural systemic aspects of NTDs. I myself have tried to avoid mentioning the structural aspects many times over the last 14 years of working on noma. And I did so because far too often, while sitting in meetings with various officials, I was told that, and I'm citing, the actual problem with noma is poverty. This acknowledgement did not make me rejoice, because it was delivered as a statement of the futility of even attempting to address noma. The story went, we can't solve poverty, we therefore should not try to work towards noma's prevention by, for example, including it in the NTD list. This is a fatalist fait accompli, and if you allow me, this fait accompli was usually delivered by men in position of power from the global north. So my response to such statements has been to first point out how easily noma could actually be treated if caught early on, and second, to emphasize the legally binding human rights duties states have to address it. Today, and looking at social science and medical research on other entities such as snakebite and leprosy, I suggest that we must consider the structural aspects of NTDs alongside operational efforts such as NTD framing. And allow me to conclude with the following passage from a recent chapter co-authored with Alice Trottert and published in a forthcoming volume on global health justice. The human rights and NTD frames of noma need to find ways to become increasingly compatible because their individual success lies in their complementarity. Not only is it possible for these two overarching framings of noma to coexist, but we move to suggest that translation of this coexistence into policy and action will be necessary to the long-term advancement of the agenda. Doing so will go some way towards recognizing that it is no longer possible, if it ever was, to separate what is medical from the social, the economic, the cultural, and the political. Thank you.
Thank you so much, Joanna. My next question to the panel was going to be, what are some of your main recommendations? But we have heard you loud and clear. Cross-collaboration between socioeconomic, legal, medical sectors. And we know in the field of NTDs that this does work. For example, in leprosy, where partners came together and changed labor laws to include to change those labor laws so that the inclusion of people affected with leprosy would be a lot easier. So your message has been heard loud and clear. So perhaps I'll just go back to you, Bernd Thomas, and from MSF's point of view, right now, what would be your main recommendations to drive the noma advocacy agenda forward?
Thank you. I think from MSF, we're very clear that this is getting noma onto the NTD list is not the end of the road. It's not even the first meter of that road. We know the road to getting noma actually not being such a significant illness, such an devastating impact on individuals, we will have to continue fighting. We would have to continue fighting together. We'll have to continue fighting in our individual corners, and we would have to make sure indeed that this opportunity that we have as Fidel being present here, those who are survivors of noma are center in this fight against noma. I really think that we, as also highlighted earlier, we have an opportunity that at every interaction that the healthcare worker has with a child or an individual, it's an opportunity to actually prevent and detect early, prevent noma being the devastating illness that it is. So there are a whole list of intervention and directions we need to take, but I really think that we feel that ultimately that moving noma into the mainstream and ensuring that every interaction that a healthcare professional has with patients is not lost. It is an opportunity to prevent the devastating effects of noma. Thanks.
Thank you very much, Bernd Thomas. And so, Fidel, you've heard Bernd Thomas, you've heard us all. You are center, you are a leader. So the last word for this panel discussion really goes to you. And what would you like to see more of as Elysium kind of gathers pace and as the momentum for noma advocacy grows and grows?
Well, I have to say, noma is quite a complex thing. So I am not a medical expert. I also don't have any PhD in political science or whatever. But I think nonetheless, we as survivor, as Elysium Association, we should have the right to partake in, also in, or give input in decision makings, because oftentimes you have brilliant ideas which may be working, but in the long run it is futile. So the fight here is really to focus on the long run, and not just for 2, 3, 5 years. It's really like 10, 20, 30 years we have to look ahead. And we as Elysium, we want to be all the way in, and we want also to be informed and make sure that everyone works also together, because we cannot just leave one doing their job and the other do just the other job. So it's really a collaboration we are looking for between decision makers, individuals, and Elysium, we as survivors. So I think we need really to be transparent. So that's what I'm hoping and looking for, to work with everyone and just to keep the stone rolling to make change. That's, yeah.
Thank you, and absolutely, thank you for that. We hear you loud and clear, and within yourself and Mulika, I think noma has 2 very, very strong ambassadors, and no doubt you will be leading the policy agenda well into those decades and the next roadmaps and global goals frameworks. So thank you for your time today. We had penciled in a few minutes for questions to our speakers, but we're running a bit late. However, please, I'm sure you will be here for a cup of coffee, and don't hesitate to ask your questions after our event concludes in a few minutes. We're coming up to the wrap-up of this really important and fascinating and heartwarming and complicated session all in one. And so just to wrap up, final thank you to our panelists. And while we swap you over for our last speaker, I'd like to introduce very warmly Dr. Bente Mikkelsen, who is the director at WHO of the Non-Communicable Diseases Division, and who'll be speaking to us a little bit more about noma within the UHC, the SDG frameworks, and particularly what lessons should be learned to define the work. So very warm welcome, Dr. Mikkelsen, and thank you to our panelists. And just while Bente takes a seat, I would like to take this opportunity as well to read the very short statement from Dr. José Leonardo Ruales Estupiñán, Minister of Public Health, Ecuador, who was going to join us but could not make it at the last minute. And Dr. Estupiñán writes, the Minister of Health of Ecuador wants to extend its warm greetings to all participants of this important event on noma. Our country and region suffers from many tropical diseases and understands fully the importance that recognition has for neglected tropical diseases, which is why we have decided to join in full solidarity this initiative. In this particular case, the noma disease can have severe consequences and affects mainly the most vulnerable and poor people who suffer from malnutrition. It is preventable and treatable and requires a global response. In this regard, Ecuador fully supports its inclusion as a disease in the WHO listing of neglected tropical diseases and hopes other countries and partners continue to support this cause. Thank you very much. And thank you to Ecuador, who's really summarized and echoed all those voices that we heard right at the start of the event. So without any further delay, hand over to you, Dr. Mikkelsen. Thank you for being with us.
Thank you very much, and it's such a pleasure to be here. It's 1 year since we met last time, and so many people, 500 online, in addition to this distinguished audience. I would like to first of all thank Mr. Fiedelstrup. I think when you're talking, it's so sobering. You talk on behalf of the 90% that didn't make it, and you use 20 years to accept your situation. So I think, what can we say? We are here to support. So again, good morning, colleagues. I will give some more thank you, but I will also update you a little bit on what we plan to do at WHO. And of course, my colleague has already spoken, so you have heard a little bit. And this is a very strong collaboration between the NTD department, which is headed by Director Sosha Fall, and the NCD department, but also many other departments. So first of all, I would again like to thank Médecins Sans Frontières, the Swiss Alliance Against Neglected Tropical Diseases, and the Geneva Health Forum, the International Society for Neglected Tropical Diseases, and Elisim Noma Survivor Organization for your kind invitation to attend today's event. This thanks is from, I guess, all of us. I would especially thank the Honorable Dr. Osaige Ehanire, the Minister of Health of the Federal Minister of Health of Nigeria, for your ongoing commitment, and congratulate you on the continued efforts to fight against noma that include the lead of the development of the dossier on noma that was submitted earlier this year. And it's amazing that we now have 32 countries supporting this dossier. So I will again also reiterate my admiration for the noma survivors who tirelessly fight against discrimination and advocate for more resources to eliminate the tragic disease in affected countries. And I think, again, it was a really wake-up call from Dr. Iona here today, who reminded about the accountability that comes with support. So thank you for that. So thank you for being here today. Also Mulikat Unkangliwala, noma advocate and hygiene officer of Sokoto Hospital, Nigeria, and again, Fiedelstrup. It's also delighting to see a wide range of stakeholders, including both representatives from member states and non-state actors joining us. We all know that noma is more than a public health challenge. Noma is, as was mentioned many times today, but we need to always remember, it's a result of extreme poverty, of malnutrition, lack of access to clean water, sanitation and hygiene, and also limited access to healthcare and vaccination, among other factors. Thus, it is a requirement of comprehensive and intersectoral approach, and our success in the ambition to tackle noma depends on our capacity to collaborate specifically on noma, as well as in the wider context of the Sustainable Development Goals. And I think it goes beyond any discussion that we all have a role to play. Member states, WHO, non-state actors, academia, healthcare workers, donors, development organizations, and of course those who have been affected by noma. As we move forward, a truly interlinked collaboration effort is needed. And I'm pleased to see that the momentum is actually really here, and it continues to gather more and more people to join in. So I'm now going to tell you a little bit about what WHO is doing at the moment. So our three main objectives to fight against noma include, first, to support cost-effective interventions on noma integrated into NTD prevention and control programs in affected countries through the UHC agenda. And I spelled that out very clearly, the WHA agenda. And I want to remind also this audience that it is the second high-level meeting on WHA. So you have an opportunity to also make your voices very strong for noma in this perspective. So please use the opportunity. Under the mandate provided to WHO through the landmark resolution on oral health in 2021, actions to address noma were included in the Global Oral Health Action Plan, which has been endorsed and also will be endorsed again as we see during World Health Assembly. So in alignment with this, WHO is working on the integration of interventions to prevent and also to manage noma in its early stages as part of the compendium for universal health coverage. So this will help countries prioritizing noma activities at primary health care level. And we will not achieve, of course, UHC for all if noma is not part of the UHC agenda. Within WHO, while we are awaiting the recommendations by the Strategic Technical Advisory Group on NTD, we have already joined forces with our colleagues, as you heard earlier today with Dr. Kingsley, and this includes also incorporating noma into technical products. So as already mentioned, we have integrated it into the Skin NTD app, and the WHO Regional Office for Africa Oral Health Program launched an online course on noma to train health care workers at national and district levels on skin NTDs. And we will do our best to spread and disseminate this program, of course. So the second important objective of WHO is to facilitate effective collaboration among all national and international stakeholders, including noma survivor groups working on noma. So again, going back to the landmark resolution on oral health, we also planned for WHO 2023 review process to consider the classification of additional diseases within the roadmap for neglected tropical diseases 2021-2030. And in support of this mandate given by the member states, we convened, as many of you know, a stakeholder meeting on noma, which we co-hosted in collaboration with the WHO Regional Office of Africa last year in May. It was a very important event. And one of the conclusions of this meeting was that we need to strengthen collaboration between different actors in the fight of noma, and also to find synergies and to undertake real action at national, international level. So we are at WHO ready to support and facilitate this process. This is a typical situation. We cannot create a separate system. We need to really integrate and build on. So the last thing is to strengthen international research, and I think it was mentioned already a couple of times. We don't know enough about etiology, prevention, therapy, rehabilitation, and surveillance. And we need to fill these gaps of the origin of the disease, about its determinants, and also associated risk factors. We also have difficulty in estimating the incidence and prevalence of new cases. And as we, of course, understand, without this kind of information, it's very difficult to build a real case. So in short, research on the disease must be accelerated in the coming years. So I make a plea and an ask. You're here as an audience, but you're also here as actors. I know that you have networks that you can activate. Please help us to inspire. At the moment, I would like to mention the University of Oxford and the Infectious Disease Data Observatory that WHO have been collaborating with on an updated systematic review of the evidence-based knowledge on the distribution, associated risk factors, and the prevention and treatment modalities for noma. The report will be available soon. We are also committed to explore how we can further foster relationship with partners to better mobilize, coordinate, and facilitate, support all kinds of efforts to promote the global research agenda on noma advocacy, and also, of course, funding. So I'm sorry that I was a bit long, but I thought this was a golden opportunity for you to know what WHO is doing. And that is also a call to action for you. If you find that there are other areas that we need to focus more on, this is a joint effort. So please keep the conversation going. And thank you again for coming. Thank you for organizing. And thank you for having me here. Thank you.
Thank you so much, Dr. Mikkelsen. You said you took a long time. Actually, it's the other way around. We wish we had a lot more time. You've really unified today's voices very nicely, covering all the very important points that we need to be thinking of as this meeting comes to an end. So obviously, we're here today building on past events and on the momentum. We know, on the one hand, that intolerably, noma continues to exist. At the same time, there is a very kind of strong will, whether political or moral or personal will, to really attend to noma, and also a very concrete network growing. So these are all very positive things, a network that is strengthening and accelerating. So all these are very positive things, and noma is, as has been said quite a few times this morning, finally getting some of the attention that it does deserve. Right now, quite literally, there is a dossier in WHO for noma to be recognized officially as an NTD. But of course, all these things are, to echo your words, only a beginning. And I'll just pick up again on your call to action. That is very true. If if there's one thing that you can do today, as this meeting concludes, if you are a member state, please do consider adding your voice to the dossier. If you are a researcher, and that's very important, but we didn't have time today to touch on that, but there needs to be more basic science done in noma. And if you can't at the moment do any of those things, quite simply going on YouTube, perhaps sharing the video that we saw this morning. If 500 or 600 with those here do that, just one share, it's kind of the analogy of the butterfly wing that has a tremendous effect. And so linking noma and UHC, I suppose the final message of today is change one thing and change everything. So on those words, I'd like to thank you again for your participation. I thank so much all our speakers today, and we have left you exactly a minute and a half for a cup of coffee. So please don't delay, and we hope to see you very soon at a next event or in the noma network. You're all in it now, so thanks for joining us today. Thank you. And a big thank you to those who have connected online. We hope to see you in person next time. Thank you.